Unit 10, Key Terms for Nutrition, Martha Olson. Parts of the eye include both the cornea and the retina. The cornea is that outer transparent surface of the eye, whereas the retina is that very paper-thin tissue that lines the back of the eye and has the very sensitive cells called the rods and cones. The rods are for black and white and the cones are for color. Words connected to the eye are also iodosopan. Those are the color-sensitive pigment molecules in the cone cells. Dark adaptation is where the eye is able to increase that amount of rhodopsin concentration in the eye, allowing them to detect images in the dark better, and that has to do with like a night blindness or a deficiency. Carotenoids are that group of orange, yellow, and red pigments in plants. These are the carrots and the pumpkin and the deep orange that we eat oftentimes in the fall. Many of these compounds are precursors to that vitamin A. Menaquinones are the vitamin K. We think of the vitamin K as the blood clotter. It comes from animal sources or is produced by the intestinal bacteria. Many of the nursing students, their first injection is on a newborn. We give a vitamin K shot because their bacteria, they do not have any bacteria, their gut is sterile, and we worry about hemorrhage or lack of clotting. Menindone is the medicinal form of vitamin K, and it's also known as a vitamin K3. The myelin sheath is that protective coating around the nerve fibers. Epithelial cells are very closely packed layers of epithelial cells that cover the body and line the cavities. A little bit of chemistry, looking at decarboxylation, is the removal of that carboxyl group or that COOH from the end of that molecule. It's then released as a carbon dioxide, and it pulls off and makes water. Carboxylation is that reaction that adds that carboxyl group, replacing the hydrogen atom. Our protein is a protein produced by the salivary glands that helps protect that vitamin B12 as it goes through the stomach with the acid and into the small intestine. Provitamins, pro is before, so that is the form of a vitamin when it's inactive in the body, and then it is converted when it gets to where it needs to be to the active usable form, also called a precursor. So a provitamin A, the carotenoid precursors of vitamin A in foods of plant origin. And again, vitamin A is mostly found in your deep oranges. Many of the colored fruits and vegetables have a lot of vitamin A. Tocopherol is the chemical name for vitamin E. There are 4 kinds: alpha, beta, gamma, and delta, but only the alpha is active in the body. And tocopherol is collectively known as vitamin E. Our reducing agents, compounds that donate electrons or hydrogen atoms to another compound, is called a reducing agent. Our retinoids are compounds in foods that have chemical structure similar to vitamin A. They have active forms of vitamin A known as retinol, and retinoic acid. And the main form of storage then is as a retinol ester. The alcohol form of vitamin A is retinol. A vitamin A deficiency that dries the cornea and the mucous membranes of the eye is xerophthalmia. A vitamin D deficiency can either be seen as rickets or osteomalacia. Rickets is often seen in children that have lack of vitamin D, usually your dairy and milk products in their diet. And osteomalacia, malacia means softening, and it's in adults. It's from vitamin D deficiency, and it's the softening of the bones that leads to bending of the spine. The legs are bowed, and they have more fractures. The active form of vitamin D is calcitarol, and it's an important regulator of our calcium levels in our body. Any substance that can cause a birth defect is a teratogen, and the reason that's talked about in this chapter is because Many people take too many vitamins thinking it will prevent colds or prevent other health problems, and they actually will cause some birth defects. So we have to be very careful with the amount of levels of things that we take to avoid causing birth defects. Osteoporosis, very commonly known in society, it's the decrease in bone mineral density. The bone has the appearance of small holes because of the loss of the minerals, mostly calcium. And then calcineurin is a hormone secreted by the thyroid gland when we have an elevated blood calcium level, and it stimulates the calcium then to deposit in the bone and be excreted by the kidney to reduce the blood calcium. Arabinoflavinosis is a deficiency. The A as a prefix is without, and so it's without riboflavin. Beriberi actually means a thiamine deficiency. Beriberi is a term used in other countries where I think I can. Symptoms include weakness. These were people that were laying alongside the road that would be asking for help, asking for a handout because of the thiamine deficiency. And we know that thiamine deficiency is often seen in alcoholics. Chelosis is inflammation or cracking of the lips. It's a symptom of that riboflavin deficiency. Hemochromatosis is an excess iron in the body. Atrophic gastritis is related in the stomach to the loss of ability to secrete acid. It's usually age-related, and in a lot of severe cases they cannot make the intrinsic factor, and so that would have to be replaced by an injection. Neural tube defects, we often think of folic acid. We know that neural tube defects have decreased significantly in newborn babies as a result of folic acid being added into many of the food products, included cereal. Neural tube is that birth defect from failure of that neural tube to develop. That's a nervous system, and we know that that is developed very early in a pregnancy. Spina bifida is one specific type of neural tube defect. And anencephaly, remember the A again is without. Anencephaly is a neural tube defect where they are born without a brain, and it's always results in the death of that child. Glossitis is inflammation of the tongue, and it's usually from a riboflavin deficiency. The tongue looks very big and red. Angular stomatitis is, again, the cracking of the skin at the corners of the mouth, and it's from riboflavin deficiency. And as we look at the term night blindness, it's the inability of the eye to adjust to dim light, and it's usually as a result of vitamin A deficiency. Finishing up then, looking at anemia, we know that it's a low concentration of hemoglobin in the bloodstream. It's usually caused by an impaired synthesis of red blood cells, increased destruction of the red blood cells, or a blood loss. We see this very, very often in hospitalized patients or in long-term care patients because it is so easy to happen. The person is not able to make red blood cells, or they break down very easily as a result of other health conditions. And in the hospital, that blood loss, a person that's hemorrhaged, had surgery with a lot of blood loss, will oftentimes be anemic, as well as your patient in the obstetrics unit that has had a lot of blood loss with the pregnancy. A specific type of anemia is pernicious anemia. We see this a lot in the clinic because we have to give the vitamin B12 injections once a month because they are not able to use that. So pernicious anemia is a form of anemia. It's an autoimmune disorder from the damaged cells in the stomach. We are also seeing this type of anemia now with people that are having gastric bypass or stomach stapling surgery for weight loss. Cells, when we look at anemia, we think of the megaloblasts as very large, immature red blood cells, and a megaloblastic anemia is excess amount of those megaloblasts in the blood, and they cause then a deficiency of folate or the B12. Our macrocytes are abnormally red blood cells with a very short lifespan. Macro means large. And then our microcytic hypochromic anemia is a type of anemia where they're very small, pale red blood cells, and they can't carry oxygen out to the cells. Micro is small, cytic is color, and hypochromic then tells us that they lack a lot of blood in them. And as we end up this slide with key terms, we want to look at the role of some of the vitamins in the body, thinking about antioxidants, helping to keep the body young, to prevent cancer. Antioxidants are a term we see a lot used, and that's our vitamin E, C, and our carotenoids, or the deep oranges in the diet. Our coenzymes are kind of like the oil in a car. You have to have gas in the car to make it run, which is like your carbs, proteins, and fats, but the coenzymes are like the oil and the other parts in the car engine that help stimulate or keep things going, and that is your B vitamins. Bone health, we think of vitamin D, vitamin K. For vision, vitamin A, with the lack of vitamin A causing night blindness. So when your mom told you to eat carrots, they have a lot of vitamin A. Carrots are good for your eyes. And then our blood clotting again is vitamin K. A person going into surgery that has problems with blood clotting might get a vitamin K injection to help them to be able to form blood clots to prevent hemorrhage. This is our key terms for our unit. I hope this was helpful in preparing you for the reading of the lecture and the text.